without which we won't be able to accomplish our goals in either clinical trials, treatment, prevention, helping people who are surviving with this disease, from this disease. All the things that we talk about, educating people, helping them be oriented towards prevention, are really limited somewhat if we don't have an adequate and healthy workforce. This was something that we identified, actually thinking back as a reflection on the 10 years, as we were transitioning from a dialogue to sea change. Now, all the disciplines we recognized are important as we started this process of thinking about the workforce. Physicians, nurses, social workers, registrars, dosimetrists, the list goes on. Dietitians. I have to say that because my daughter's one, registered dietitian. But all of us seriously have a role. Many of us know that there are shortages which are out there in each of these fields, unfortunately. If we're going to have an adequate and diverse workforce to meet the adequate growing population of our country that is going to continue to be at risk, we recognize this needs to be dealt with. So the workforce team was convened. We had a meeting in the tradition of the sea change activities. We were presented as a team, as I recall, with about a 4-inch binder, about this thick, of reports and information about the shortages, about the real challenge here of trying to address the workforce going forward. And I'm pleased to say that instead of trying to help really solve that issue, which we all knew needed to be addressed, because we all know that we each had roles in helping address those shortages, we said, what could we do differently? Contemplating on our theme and what our challenge was for sea change, what could we do differently? So we decided that we would take on the opportunity to engage what we would call the cancer core. Try and expand the number of people who are non-oncology specialists in the effort of educating, encouraging, supporting people through this wonderful thing we call collaborating to conquer cancer. Now, one of the things that we identified there was the real potential. I'll give you one quick example. In the area of oncology nursing, there are about 20,000 of those individuals certified, yet there are about 2 million nurses. So the concept, I think, helped us at least quickly realize the potential for us to really expand quickly, to really deal with the need that is out there in a different way. However, the challenge became, how do we do that? What do we help get to these individuals who we're trying to engage in helping collaborate with us to conquer cancer? And that led to a discussion of what are the kind of core competencies, what are the key skills, what are those things that anybody, not an oncology specialist, again, not like all of us probably in the room, but other individuals, what can we do to really engage them and provide them with the skill sets to help us accomplish this goal? And to help us really understand that, we started a core competency development project, and I'm going to ask Maureen Litchfield, who chaired that effort ably, to go up and, if you would, Maureen, and tell us a little bit about the pilot project that we've just completed, where we demonstrated the ability to really do this.
Good afternoon. So my job is, in addition to tell you about this, to wake you up. I saw several of you sneaking out and going and get these huge chocolate chip cookies, so just don't let that sugar level turn you down. We never do things by ourselves at Sea Change. We do things as a team, as a group of members. So I'd like to ask the members to give a shout out. I'm now a professor, so I can say, give a shout out to all the members of the workforce team. Please stand and be recognized. And yes, Nora. So I lost a little weight because together we birthed the baby. You can't see it, obviously. But we wanted to make sure that birthing wasn't enough. We wanted to make sure that the baby can actually walk. And so in order to, and you know when you walk, you fall down. And so here is the walking and fall down effort. We took the competencies out, which really are benchmarks. Just the word is so sometimes so boring to understand. So if you think about quality benchmarks, you could address competencies that way. And so we took them out to 4 different areas, and actually 4 very different situations. The first one is the Marshall University School of Medicine. There, with second-year medical students, we used the standardized patient program to focus on the breast cancer screening benchmarks and the patient communication benchmarks. Then we took it all the way to the front line, to the trench, as Jim would say, in Mexico, Missouri, the Audrain Medical Center, where public health nurses use the skin cancer benchmarks to influence and increase their quality in providing skin cancer care. I had to get used to the fact that California University was actually in Pennsylvania. But at California University in Pennsylvania, social work students and field instructors focused on a very real area of cancer care, and that's anxiety and depression. And we were very humbled by the findings that they had through both classroom and online standardized patients. And lastly, but certainly not at the least, since Ron is here, the University of Pittsburgh Medical Center focused on the rural primary care practitioners, and often those are the only practitioners that can provide cancer care, and an area of cancer care that's critical to us in that continuum and that survivorship. So what did we find? First, that actually the baby was useful. There was utility to it across all the pilot sites. Secondly, that we were flexible enough in the creation of those national benchmarks that they could be used not only across the continuum, but also across several professional settings, as you saw through the pilots, as well as across the disciplines. And thirdly, in the area of outcomes, we saw a % change of improvement in knowledge between 20 and 177%, quite astounding. We saw improvements in clinical skills as well as in interpersonal skills. There was an area where they felt a lot more comfortable and confident in dealing with cancer patients. They intend to change not only their practice, but they intend to change moving on to other areas of cancer, and particularly the marketing and the propagating effect in involving other colleagues. This is my axe slide, and so I'm sharing my axe with you. I did not tell Allison and many of the members of the team that I actually was nervous when we took this out, because I didn't know how, for the first time we used mixed strategies to pilot these benchmarks. But here's what we found. At the professional level, we saw a real increase in professional development. At the learner level, in addition to increases in knowledge, which you might expect, we also saw an enhanced academic experience and a real opportunity for professional self-reflection, looking at their own career and then moving into a career in cancer. At the institutional level, we were very thankful that many of the competencies were already integrated in curricula. And then lastly, within the community saw a benefit because they had a better relationship between the providers now that they could also approach the providers for cancer care. Where are we going? Yes, we will publish the findings. And by the end of December, you will have at your fingertips, and I know there will be a call to action, so this is my first dare to you. At your fingertips, you will have a set of tools that you can use immediately across all the settings where you are as members and members of members and family of members, and wherever you can push this out, you will have a set of tools on the C-Change website for ready use. We're asking you to not only look at the tools, but implement them, use them. Lastly, what I'd like to share with you, as many of the organizations represented here were together last month in October for an unprecedented meeting at the Institute of Medicine. The National Cancer Policy Forum convened and devoted its entire forum for 2 days on the issue of the cancer workforce crisis. For the first time, together, we will be able to develop a national agenda on dealing with the cancer crisis, not within the silos of the disciplines, but across all disciplines in a science-driven way. And I couldn't be personally more excited about it. And for so many of the organizations, we will be one in developing this national agenda, and in influencing policy is our goal. I'd like to turn it back to Armin now to talk about how we use these tools.
Well, thanks, Maureen. You know, this is again, I think it's a great example of how we've managed to leverage the talents from the different perspectives, different disciplines within the organization. One of the things that strikes me is that, you know, we found a unique niche, in a sense, and it's one that I know that others around the tables here may not be as familiar with, because some of you may not have been as involved with the development of core competencies, this idea of competencies. But I would like to ask one of our colleagues, if I can, Betsy Clark, to tell us a little bit about how this concept has transferred to her and her organization. Betsy?
Thank you, Armin. As Armin said, there are millions of nurses who are not oncology nurses. Well, I represent social workers. There are over 600,000 practicing social workers in this country. Probably fewer than 5,000 have ever had any training in oncology social work. So it's a huge fertile field for saying, how can we get basic competency knowledge out to social workers? We've been working on that for some time at NASW, and we've found that by developing some continuing education courses on basic cancer information, we've been able to reach a large number of social workers. We did our first course called Just Understanding Cancer, and we've had over 30,000 people complete that course online. We just recently did one on cancer caregiving, because that's certainly becoming an issue that we're hearing as we move around in meetings in the country. Caregiving is becoming so important. And in about 3 months, we've had 11,000 people complete that course. But not wanting to just waste it, and I mean that in the best possible way, on social workers, we also have a consumer website. So we've taken out the clinical intervention pieces, the basics, and we've moved the courses to our consumer website, so that anybody who's coming onto our website, which is called Help Starts Here, can also learn the basics of cancer. We have found this very successful. Social workers, by the way, are about 81% women. So if we can reach women who are the mothers and the wives, sort of the decision, oftentimes medical decision makers in a family, we've in some ways killed 2 birds with 1 stone. And just recently we've taken this, the same process, the basic competencies, and we've actually just last week held a summit in Hungary at trying to help sort of enhance psychosocial oncology in Hungary, and we actually had that online, and our basic course now is in Hungarian. So when you go on our website, you find it in English and Hungarian. We need to get to a few other languages, and Hungarian is a first translation. But there are a lot of Hungarian immigrants in this country, a lot of people who could benefit from a course in Hungarian. So I think by taking this, the basic competencies that we know everyone should know, whether they're in health or mental health. And remember, social workers are found in many venues, in schools, in prisons, in mental health clinics, in substance abuse clinics, in private practice. If every social worker could know the basics, as I said, if they only knew the answer to why should you go and look at a clinical trial, we would move things forward dramatically. So I think these are exciting things. The only thing I would like to add, one of the things we've done with our courses is to make them free. That we do charge for CEUs for other things, as most of your professional organizations do. But we think this is so important that if we make these free courses for everybody, we have a much better chance of getting people to come. So we've had a wonderful experience in our partnership with Sea Change, and we welcome more collaboration.